Hey guys, Oscar here with Gastroenterology Simplified. Today we're going to touch bases on esophageal cancer. The reason I'm doing this video is because one of my good friends was recently diagnosed with esophageal cancer, and I believe we should touch bases, make it simple, so if anyone could benefit from this information, hopefully I can help them out. Let's go ahead and touch the basic information of esophageal cancer. Usually, esophageal cancer affects individuals between the ages of 50 and 70. Males are affected more than females, and the ratio is 3:1. There are two types of abnormal cells. There is adenocarcinoma and squamous cell carcinoma. Adenocarcinoma usually affects white individuals, and squamous cell carcinoma usually affect blacks. What are the risk factors? Risk factors are smoking, vaping, alcohol intake, history of Barrett's esophagus, history of achalasia, to name a few. Usually about 90% of the individuals present with dysphagia, meaning trouble swallowing and usually to solid foods. Other symptoms are painful swallowing, unintentional weight loss, poor appetite, atypical chest discomfort, back pain. What diagnostic tools are used? The best tool to diagnose esophageal cancer is to proceed with an upper endoscopy, usually known as an EGD. The reason this is one of the best tools is because you're able to insert a camera through the mouth and get random biopsies. The biopsies are taken to the pathologist, and the pathologist can study the cells and make a definite diagnosis. Other tools could be an upper GI barium study, and if there is a positive diagnosis, then likely you will need staging, and likely you will need a CT of the abdomen, CT of the chest, and so on. What are the treatments? Treatment depends on the stage of the tumor, but usually you will need combined radiation and chemotherapy. Sometimes you may also need surgical intervention, but this is depending on the findings. In conclusion, about 15% of the individuals have a 5-year survival rate. My recommendations is to avoid the risk factors such as smoking, vaping, alcohol intake, and if you have any type of vitamin deficiency, correct that. If you have a history of Barrett's esophagus, then get routine upper endoscopies. If you have a history of achalasia, then get routine upper endoscopies, and so on. If you are experiencing any of the symptoms that I have mentioned before, which I'm going to mention again, such as painful swallowing, poor appetite, unintentional weight loss, esophageal dysphagia, which is trouble swallowing, then you should see your primary care physician, and your primary care physician could and should refer you to a gastroenterologist for further evaluation and management. If you found this video helpful, please click like, subscribe, and share the video. I truly hope you found this video helpful, and I will see you in the next one. Bye.